Testing, testing. Why isn't this working? Okay. Okay, that works.
And I'm a consultant quality coach with CQII. And I am here today to pick up our discussion on process and flow. And whereas last time we were talking about, I'd say like a more intermediate, like how do we measure flow in a simple process? Today, we're kind of picking up with a more advanced look. We're going to be talking about improving flow through systems and the tool of value stream mapping to help us improve flow through systems. So for those of you that caught part one, welcome back. For those of you that didn't, don't worry, we're going to do a little recap to get everyone on the same page. Kevin mentioned that these will soon be up on the Target Center YouTube. So go ahead, if there's something that you want a refresher on or you want to take a look at again, they'll be up there for you to look at as well. So thank you for those that are putting your names and email and organization in the chat. That's greatly appreciated. So by the end of this presentation, I hope that you have a better understanding of creating a value stream map from a basic flowchart that you might have for a project you're working on, or a SIPOC diagram, which we'll talk a little bit about today. I hope you're able to understand the pieces of the value stream map, some of the commonly used symbols. We're going to talk briefly about calculating process and time metrics and about the advantages that a value stream map gives us versus a traditional flowchart, which you might be more familiar with. I hope you have an understanding for seeing waste and variation in complex systems with a value stream map, and using process states to plan iterative improvements, and really pay attention on this idea of process, because this applies if you're using swim lane maps, spaghetti map, value stream map, flowchart, any type of process map. By redrawing the map in various states, it's going to help you plan your improvement cycles. It's such a great help. It's really a game changer. So we have an ambitious afternoon ahead of us. Any questions or comments before I jump in?
I don't see anything in the chat either, so you're good to go.
I'm going to go ahead here. So picking up from part one, as a recap, quality improvement is all about improving processes. That's what we're doing. You know, we're not maybe thinking about just a measure or just some feedback we received, but how does that fit into a process and how can we improve that process? And we said that all processes have flow, that flow can be interrupted, where there's a lot of things stopping that process from getting to start to end, or it can be continuous. And that flow is smooth, it's consistent, it's probably quicker. And so resolving interruption of flow, it increases our capacity to provide services that are really meeting the criteria we think of high quality. They're valuable, they're equitable, they're efficient, effective, they're patient-driven. We can do them quickly and timely. And so many of our problems, they don't really come because, oh, we don't have any good ideas, we don't have good people, you know, we may not have enough people, but the people we have are generally pretty good. It's really missed opportunities. I think of like that low-hanging fruit, or even fruit on the ground. It's that lack of capacity, capability, standardization in our processes. Those are the things we probably want to look at first before we bring something new into our systems. So we're going to look at our processes. We're going to find the problems. We're going to get the great people to help us find solutions. And so today, we're going to move on from is where we left off last time. Flowcharts, we talked about, you know, how to use them, how to look at them, how to, you know, see the idea of a bottleneck visually in a flowchart. And they're great tools, but they still have some limitations. And as our projects become more complex and have more pieces and more people, a value stream map can be an alternative way to look at some of these things. So before we get into value stream mapping, I always like to do a brief review of value. These are, as we talked about last time, they're kind of, it's a plain language word that we all know. We all have an idea of something is valuable, whether it's, my family, my time, my new car I want to buy. Like all these things have some value, right? So the technical definition of value is that the customer wants it. It fundamentally changes the service experience, and it has to be done right the first time. If it's something that the customer really wants, it's cool, it's new, it's innovative, but we can't get it right every time, then it's not providing value. And the next one is either requirements, or sometimes you'll hear essential non-value added, we know it's non-value adding, but we can't get out of doing it. And those are things that are required by our patient, our consumer, our customer, the client, required by the organization, or they're required by law. And I think there's a real temptation for folks to throw a lot of things into requirements or essential non-value add when they first get started. However, these are things we need to challenge, like things like, oh, it's a policy of our organization. Those can be changed. They're not necessarily always requirements. I think of requirements are things like, okay, if HRSA is telling us to do it and it's in the legislation, yeah, then that's a requirement. And then last but not least is non-value added. I'm always careful here to say non-value added and not waste, because non-value added doesn't mean unimportant. Things like data collection are none of our clients or customers are going to pay for like us to collect data. They don't care about it. They just want the service that results of that data. So if we could make sure that we're doing everything right the first time with no data, boy, what a world that would be. It's probably not going to happen. But the data is not something that is value from the client or customer perspective. And as you define your customer, that's why it's important to do that in a value stream map. If it's an internal project with an internal customer and they really want that data, well, then it's a different story. So I'm going to start with the idea of a real basic beginner value stream map. And if you've never done a value stream map before, I think this is the easiest way to get the idea and to understand some of those advantages that a value stream map has over a flowchart. So just take something, either map a flowchart if you haven't already, or take one that already exists, get that project team together and just talk through each step and make sure you have a diverse group here. Hopefully you're including some clients or patients. Hopefully you're having some frontline staff. Hopefully you have some senior management. So they're kind of aware of how you're kind of thinking through things. And you're just going to use sticky notes or green markers, or do this, digitally with some dots of different colors, which you'll see in a second. And we're just going to mark things that are value added, we're going to put green. Things that are requirements, we're going to put yellow, and things that are non-value add, we're going to mark with a red mark. And again, there's no, at this point, like this is a beginner. This is not being super data driven and looking at, capacity and inputs and outputs yet. Just kind of go for a consensus. Does the end user really value this? And then maybe we're going to brainstorm some different ways to remove waste and add more value. And maybe we're going to bring some data into discussion at that point. So that's, I think, the real basic way to do this. Does this make sense for folks? Great. So, and I think maybe it's easier to even see it, right? So you'll end up with something that looks like this. This is a pretty classic flowchart. It's the same example that we had in the previous session. Just the only difference is now I've went through with the team and we've put some, marks signifying if it's value, requirement, or non-value added. And things like, okay, we got to make sure we have those two patient identifiers and we got the right person. And so they know who they are. They don't care. But for our joint commission or whatever, we got to make sure that we're, asking them twice. And so we know it prevents errors, but that's a requirement. When they're, having to like fill out forms, if you've been here before, it's maybe to look at if anything has changed from last time. Well, if it hasn't, from the patient perspective, that's a waste of my time. I'm filling out a form that I've already filled out before, and then you're entering it into another electronic system. So you're doing duplication. You're taking my paper chicken scratch and putting it into the computer. So that's probably a non-value. Patient wait time. That's usually whenever you see a wait or delay, that's going to be usually a non-value add. So they're interested in getting their vitals taken, making sure that things are those values are where they need to be. They're seeing their provider. That's a big value add. That lab is a value add to make sure that we're getting the tests that we need to get done. So, so we can see things. If I was with a team and I was looking at this, I'd say, okay, can we, maybe we have some ideas about, we could use a patient check-in kiosk and eliminate some of that duplication, but that requires new equipment, new materials and things. But maybe we can decrease those wait times. Maybe that's the place where we want to start, is the patient is waiting 2 times here. So we might start our improvement process around how do we decrease some of these wait times. We can quantify them. So is everyone following along so far? This all makes sense? Good, I'm seeing some heads nod.
Yes. Great,
awesome. So this is a really basic visit, right? And I know some of you out there and you're saying, but wait, I have a complex process, 6 swim lanes, all these measures, connections to different workflows. I have 2 different data systems. We need to do a lot of PDSAs quickly and on top of each other. I'm looking at in another project I'm working with, basically networks of clinics that want to do rapid ART, right? So there's a lot of different pieces, and maybe so these are the kind of projects you're doing, or saying, oh, these are the type of projects I need to be doing, and all this complexity. So when your projects look like that, you probably need a little bit more of an advanced tool. And so I'd also ask you, if your project, if you have a flowchart that looks like this, look at your scope. Maybe you need to fine tune that scope a little bit. But we can have projects that are in scope that are kind of big and complex. And I'm going to go through that right now. So an advanced value stream, what does that look like? So before we create it, before you jump right to a value stream map, there's some things I like to recommend folks do. And number one is, if you haven't already, and we talked about this in part 1, go to the Gemba, go to the actual place where the work is happening. And do the steps of go see, ask why, and showing respect. It's really important that if we're going to do a value stream map, we make sure it is based on what's really happening. So you're going to do your demo walk, and then you're going to debrief on what you find. Like hopefully you brought a stopwatch with you, or use the stopwatch on your phone. You talk to people. You said, hey, what are your pain points? What are the things that make you proud or happy that go really well? What are the things that could work better? And then we're going to debrief on that. We're going to see some things that we saw that maybe could work better, maybe could be done differently. And it's good to include the team, especially if you found an opportunity for improvement. Don't tell someone, hey, I found an opportunity for improvement. You're not doing this the way you should be. You ask them that, hey, what do you think happened? Why did this happen? What can we do better? And then once we've done the Gemba walk, we're going to either revisit or create the SIPOC diagram. And hopefully in a minute, I'm going to show you how valuable a SIPOC is to creating a usable value stream map. This is the cheat code to doing these things. So we're going to review customer needs. We're going to look at process measures, stakeholders, data, inputs, outcomes, and we're going to get all that organized on our SIPOC from what we saw at the Gemba walk. And then we're going to get together the team and say, okay, we have everything we need. We have the data, we have the feedback, we have the eyes, the on the ground experience to be able to make this thing. And it's good to assign like one person to lead it, and so it's not being done in pieces. It can be a team approach with 2 or 3 people, but assign like one person as like the recorder, project manager, leader of this. So in my little example here, we're going to say, oh, you know what? We didn't do a SIPOC before. We just had that flowchart. So let's take a look at that SIPOC. And so SIPOC, I think there's already, it was probably from Ryan White 2020 conference, but there's another webinar I did where I went a little bit more in depth in the SIPOC. So if you're not familiar with the term SIPOC diagram, take a look back at that. Essentially, SIPOC is just an acronym for stakeholders, inputs, process, outputs, and customers. And all we're doing is organizing those into a value stream. And so my stakeholders in this process are the patient, the front desk, the MA, the provider, the phlebotomist, and the case manager. And for those of you that might be familiar with the swim lane map, it's kind of the same thing. We're just going across this SIPOC, and we're kind of seeing all the things that relate to stakeholders and customers. So this process is the same. I usually like to keep it about 10 steps. So you see it's not fancy, there's no decisions. It's just what are folks doing? And you can see what the patient, what their inputs are, their time and effort, what they're doing, any outputs they generate, and who, like, the patients, they're customers of the staff, right? Like they need the way they interact with their staff. The staff is like an internal customer. The staff needs to be respected by the patient. And we just do that for each and every role. And I'm thinking about what are the things they need to do these process steps? What do these inputs plus process steps plus people generate? And who are they generated for? Good. So how many, just quick show of hands, how many of you are familiar with the SIPOC already? Good. See a few hands, that's good. All right, so once we have our SIPOC, the thing that I really like to do, and this isn't traditionally always done in a SIPOC, but I find this super, super helpful for improvement, is start thinking about how we're going to measure all these pieces. The strategic progress, so, what are we trying to accomplish? The what's in it for me? How can I get all these people motivated? Oh, David, I see you have a hand up. Is that for, the SIPOC, or you have a question?
I don't have a question.
Okay. And so we're going to start with kind of these high level, it may not even be a measure. It's just kind of like, what's the mission? How can we get people motivated to do this project to improve our flow? And then I'm going to be looking at input measures. So if I have inputs, I want to look at input measures. And that could be the examples here: number of staff, number of forms, number of questions on the forms. I did a project with a CBO that had like this intake form that was 9 pages long. And they're wondering, like, why are case managers and patients both frustrated after intake? Well, that was the reason. We could look at cost of supplies, that's an input that goes in as well. And then we're going to move to our process and step measures. And we're going to say things like number of handoffs, number of cycle time in minutes. So a lot of those measures we talked about and things we were looking for in part 1 on our process map. And then maybe we would drill down a little bit further that, was the case manager using the motivational interview tool that we wanted to use for some of our assessments? Was the handoff process followed? Right, so maybe these are like some checklist things that we can measure. And then we get to the outputs and outcomes. So, the number of things that were generated, and what are basically, this is the outcomes piece of this is where we start looking at value, right? The number of referrals completed, the lab outcomes, those patient health outcomes. And then we might want to look at under customer experience. So staff engagement, patient experience, prems, proms, those type of things could fit under here. So the measures are really helpful to start thinking about, because these are all these things like we can kind of measure. So start thinking about it now. And when you get to your value stream map, it's going to save you a lot, I think, some effort and time at that point. Okay, so that's the SIPOC. Now, before we go from the SIPOC to the value stream map, some things to understand are the symbols, because these are a little bit different than our flowchart symbols. You're like, oh, where are the diamonds and the circles and all that? So this here that looks like a box with 3 triangles on top, that is our customer and stakeholder in the service. These boxes, I for inventory, and that could be any inputs we need and have an inventory. It could be the number of patients we have waiting, looking at that as an inventory. The patient is the throughput in our visit example here today. This is the information control and resources. So this could be like your database, your any resources that you have. these glasses, that means walk the Gemba. Either we walk the Gemba or we need to walk the Gemba. We haven't walked the Gemba, we don't understand maybe. These boxes here are your process and resources. So again, the resources a lot of times are the inputs from the SIPOC. And we might want to be looking at some data collection. So that's why I had you collect those measures on the last slide, because those are going to fit in these boxes under here. These are our flow lines, and we're looking at, push. Are we saying, okay, I'm done, you get out of here, I don't care if you have to wait half an hour, just get out of my office? Or is it pull? Is it more, okay, you're just about done, let me pull you to the next one? That nice, warm, clean handoff with no wait time. These are Kaizen bursts here, and that means this is, probably an opportunity for a rapid cycle PDSA. Whenever you see the person, that means the person is physically going somewhere and talking to someone. So, verbal communications in person. These kind of like lightning lines here with the arrows, those are our electronic flow lines. When you see the stop sign, that means that's a quality problem. And transportation, we don't always use that in kind of healthcare and service projects, but there are cases like we've done some projects with delivery of home delivered meals, and so like transportation frequency and time came up on that. And this line at the bottom here is really important. So this is looking at our value adding time on these top boxes and our non-value adding time on the bottom, and we're going to add those up to look at our total lead time at the end. So these are our new symbols. So are folks kind of following along with these symbols if they're newer? Okay. And so, yeah, the symbols, I think, aren't the most important part. Like, if you've never done a value stream map before, like I said, starting with the symbols you already know and thinking about the idea of value is the way to go. But as you get a little bit more advanced, we'll see, especially as you incorporate more data analysis into your projects, using these symbols can be helpful. So we have the team and the coach here, and the team says, great, we understand the symbols, we got the team together, we did a SIPOC, and we're thinking about those measurements that I recommended, and we're all ready to go, let's do this. And the coach might say, perfect, you're all ready to go, let's make that current state process map, and then we'll move to the ideal state. And the team's like, moving states, we don't really know about that. So I want to review process states, because a value stream map is not something you do one and done. You're probably doing 3, 4, 5 edits to this as you go through your improvement project. So we always start with the current state, the way things actually are in the beginning. Then we go straight from the beginning to the end, the goal. What would this look like in a reasonably perfect world? Ideally, how can we do this? If we wanted to do this, provide the highest quality that we realistically can, what would that process look like? And then maybe you do the future state. How do we want to get there a little bit closer? In the next 1 to 3 months, how do we get a little bit closer to improved? Or no, sorry, ideal. And then improved is after we actually done something, what does the map look like now? Does it look exactly like our future state, or did we find some things out during our implementation or do phase that is a little bit different? So we always start with that current state value stream. So we want to make sure we have the right scope for the initiative. Again, the SIPOC is really helpful there. We want to identify like what a win looks like. I think that's so important to quality improvement, making sure we're all on the same page of at the end of this process, what do we want to happen? What does success look like? And we're going to inform process owners that this is created from actually walking that Gemba, from hearing their input in the SIPOC. And they kind of know when they look at it, they're like, they may not understand all the symbols and things, but they know they can see enough of, okay, stuff that I said is up there somewhere. You're going to agree on the icons, and we're going to keep it simple, but good enough. So why I said do a SIPOC, collect measures, is because all these things, it's a lot of just kind of reorganizing and transferring stuff over. So everything that we put in the stakeholder piece, that all fits here in this stakeholder loop over here. everything that we did for inputs, that's probably going to be captured in the information. Some of it's going to be in these resources boxes right here. All of our process, again, it's going to be these process boxes in the middle, and all of our outputs, they're going to be kind of captured in data, and our customer, that's all going to be captured over here. So, and also having these measures, like a lot of these are the things that we're going to look at and fill this data bar up with. So that's why just having a really good SIPOC is going to make this a breeze, where it can be a little less intuitive otherwise. So kind of looking through the pieces, that there's this stuff that happens in this upper right-hand corner is things that involve that customer or patient. Up in the left, this is stuff, the flow coming into our process. So things from stakeholders, you know, what has to happen before they get to our process. These middle boxes are really service delivery. These are the process steps that we mapped, and the resources, the who does it, the deliverables, the data system, the value requirement or non-value added things that we're doing and looking at. And we have our data bar down the bottom that corresponds to our measurement. And then we have our information flow in the middle. So that's all those, if you think of a more traditional flow chart, those database symbols, that information flow, it's kind of the same. We're just really centralizing. And it actually is nice because so much of our processes are now electronic, that it's kind of like, this is that central hub of information. And we can have information go from person to person as well. And you know, there's various apps that can help you do this. I use Miro, I use Creately, I use there's a couple others that I've liked as well, that are helpful and have these pre-done symbols and make it a lot easier. Great. So at this point, any questions? Okay. So if we're all on the same page, then I want us to look at another simple, realistic example together. And so if we were going to break this down, this is that exact same process that we were looking at before. I've just taken what was in the flow chart before, and I've made it into a value stream. So the patient arrives at the door. It's kind of a push flow to get started. Actually, a lot of this is push right now. And you know, the patient's waiting there. They're going to the front desk. They're getting checked in. It's all that same stuff. It's the only difference is the way that we're organizing it, and we're looking at cycle time and value added time and non-value added time for each of these steps. And so down here at the bottom, we've kind of just taken how long it takes to do, we're measuring how long it takes to do each one of these things. And so if I'm at the front desk for 5 minutes, and then I'm waiting for 16 minutes, and then I'm taking my vitals, and then, you know, I have some other non-value added times that are happening with each one of these steps. All we're doing is we're adding this total time together, and that's going to give us the lead time. And then on the bottom here, we have the value added time, which is 61 minutes. So out of the 116 minutes from the time I come to the door until the time I'm done, I'm walking out of there, it took, you know, 116 minutes, so almost 2 hours. And only about half of that time was value added time. So the rest of it was things I was required to do, or that wait time, or things that, you know, other things that weren't really fundamentally changing my service experience, or things that I don't think are high priorities for me. Great. So I see from Sanzita. Welcome, Sanzita. Good to see you again. Any tips to create improved VSM? Yes. So that's where we're headed. We're kind of taking this one step at a time. So the important thing is to think about the process. Again, some questions to ask to start creating that improved value stream map, to use this to look at opportunities for improvement and start asking questions like this. How many staff are engaged? Is it 4? Could it maybe be 1 or 2 optimally? You know, what are the challenges? What are those constraints? How many consumers or patients are in a step at a given time? Where are those bottlenecks? So if we start looking at these and saying like, oh, there's, you know, the bottleneck to wait for the provider. Well, how can we even that out? So I always like to look at non-value at a time, and just, if you're familiar with lean methodology, those 8 wastes, overburden, unevenness. And again, we don't have time to get into all those wastes today. I know there's stuff on the TA webinar, former team TA webinars that have been on lean and waste. So can the variation between client needs be measured? You know, is there a gap between what different clients need? Is there a gap between what we're able to provide and what clients need? And the wait times. So those are the things I would be looking at in these process boxes to look for improvement opportunities. So stakeholders. Again, looking at what would be helpful to know. And I was working with another project where it was a mobile prep van. And so all of their patients, they don't want, you know, hold on to them long term. They transfer them to the medical home. And they found out like, oh, you know what? There's all these things that our stakeholders at the medical home need to know that we weren't telling them, right? So thinking about resources, information, and support for that handoff. What upstream processes affect our process being improved? So, you know, if we're coming in with really bad backed up flow, you know, it's maybe like, maybe we need to look upstream before we even take this on as an improvement priority. So sometimes you can actually see that is that, you know, even coming into the system, there can be issues. Is there training for this process? Is there cross training? Do we have currently clearly defined processes and procedures? There's basically, anytime there's a handoff point, the people on both sides of that handoff understand what a win looks like. And then so information flow. I got just a quick trigger here on the next slide. Services that we can do. Is there things that we can do in parallel? You know, how long does it take to go from service need to service initiation? That's an important thing to look at. How do we react to emergencies? Is there duplication in our data systems? Are we going to do a lot of manual input? Are we having to do a lot of duplication in more than one system? And looking at, you know, how when a process is handed off, you know, either physically or through electronically, again, just asking these questions. And so we're looking at our push lines, our pull lines, and, you know, from database, electronic messages, surveys, resources, to that information control, which is, and a lot of times it's our EMR. So because the data boxes are something that's completely pretty new here and pretty different from any other of the kind of common process maps we use for improvement, I like to spend a little bit more time on these. So again, looking at all those boxes, and maybe we want to measure, you know, takt time. So reviewing that's the heartbeat of the process, and can I keep up with demand with the inputs I have? The cycle time is how long it takes to do the step. Number of people, it's in how many people are touching that. The inventory, how many patients or items are waiting. Lead time total from start to finish. And I also like to incorporate experiential data. You know, if you're doing journey maps and you're doing, you know, other kind of voice of the customer type data, we can put that right in the data boxes on the value stream map. And that way it's kind of tying together those two, the technical and experiential ends of quality. So that's another advantage that I really like about the data boxes and value stream mapping as well. So some tips, once it's sketched out, again, walk the Gemba again, if you're able to. It's all, you can never walk the Gemba, you know, make sure it's being done enough. You can never do that too frequently. Well, I guess you can, if you start annoying people, then maybe it's too frequently, but it's important to do that again. So ask those questions and capture that value from staff and patient client perspective. So then again, capturing these metrics, it could be time, it could be output, it could be complexity, it could be step measures that did we, yes, no, did we do the change as we were hoping to do it? I like looking at value at a time and percentage of value time is probably my biggest go-to. So out of each step, and then the total process lead time, how much of that is value at a time? How can we improve that? And, every process is different. Like, I think sometimes when folks are beginning, they want to make like 100% of the process, like all green boxes, all value at a time. And it's just not realistic. We have very complex and variable processes, especially in primary care. It's not a controlled environment. It's never going to be like all value added all the time. So don't get frustrated, but just kind of use your benchmark like any other measure. Use your benchmark of where you are today and look to improve that. So Sunzita, I think this is getting to your question. Using value stream maps to create improvements. So here's one. This is another process we looked at we didn't look at this process back in part one, a little bit more briefly. But this is a scheduling a visit process. And on this process map, you see there's a lot of opportunities for rapid improvement. We have big, wait times here. We have a huge variation in cycle time. There's a lot going on here. And so the questions for improvement is, again, what of the ideal state can be implemented in the next 1 to 3 months? We're looking at timeliness, productivity, equity, quality, capacity. These are the things we want to ask staff and customers. What can we do to improve these, right? And as I mentioned, it looks like there's a lot going on here. There's some big quality problems. There's some smaller things. How do we narrow that down? How do we know where to start on our value stream? So I always say a process can never work more efficiently than its slowest step. Any constraint or bottleneck, anything that prevents the system from achieving its goal must be opened up to increase productivity and efficiency. So as you see, if I want to most effectively use this slide here and the space on this slide, and it's getting tighter and tighter, bottlenecking down. Like we want to open this up where it starts bottlenecking. So think of our processes as kind of a funnel, and that constraint that we're going to capture on the value stream map is where that flow becomes most interrupted. And we kind of started getting into this concept in part one. So here in this process map in particular, I have this 1 day queuing time here, this wait here. And that's huge. It's upstream. It's right in the beginning of the process. We have tons of variation. This is where I want to start. I want to get rid of this 1 day, because if someone right off the bat, they call at 3:30 on a Friday afternoon and they don't hear back from till Monday, like that's too long. So the ideal state, like this is what the process would look like with continuous flow. And the thing to think about here is we're not going for speed all the time. Like the goal is not to do this as fast as we can. If we're doing it as fast as we can, if something goes wrong, and we know things always happen, those things that are unplanned that pop up and we can't really do a lot about them. If everyone is going full speed all the time, we're not going to be able to handle those things. So the only step we want at full capacity is that constraint. So in this here, it's the site basically. Whoever's making that appointment, that's the only step that we want at full capacity. So like maybe if we have a call center that they're taking call after call after call, but everyone else has a little bit of downtime to reset. So when we create the ideal state map, again, assume everything is reasonably possible, and we're going to map out the physical flow of people and materials, ideally, so that nothing other than our constraint is everyone else has a little bit of extra downtime in the data bar. So here's their ideal state actually involved changing, and that, hey, we're getting rid of the phones entirely, and instead that we have an online scheduling website, and you can just, no need to talk to a real person, no need to wait for a call back and confirm your appointment, this is the way we're going to work it. And there's still some challenges, even in their ideal state, because there are some support services that can't be scheduled through this system. And our new constraint in the ideal state is this system can only, if 60 patients were trying to access this at once, well, then there would be, possibly crashes or wait times or something like that. So, that could be a lot for some practices. It could be some practices could realistically have this. So going from current to ideal, we want to look at, what are the key differences? We want to paint a picture as the ideal state of like, hey, patients and staff both like this. And the ideal state is that shared vision to get buy-in to implement improvement ideas. And then we want to start doing something to improve that constraint, to get us from current state to a little bit closer to ideal. And we want to basically break that bottleneck. We want to get rid of that 1-day wait time. And so we got rid of the 1-day wait time. We worked on it. We eliminated the major waste. So now we don't have to wait up to a business day. And we were able to improve the phone tree menu. We're improving that customer experience. That's something they talked about as well. And we got rid of that 1-day wait time. So now our wait time for an appointment it's still pretty variable. It can still be maybe 6.5 hours, right? And so there's not a ton of value, like a super low percentage of value at a time. People just want to get their appointment and move on to the next thing. So what do we do next? We tried one idea that we got rid of the major wait, but what comes next? So we want to start making iterative improvements. We want to look at, okay, now that 1-day wait time is gone, what's contributing to this 6.5 hours, right? And we want to make this flow more even throughout. So some key questions as we move to a future state value stream map are, what would the customer draw this map like? What would that, we probably already know what the ideal looks like because we've drawn that. We're going to look at value-added activities and see how can we prioritize them. We're going to, again, look to get rid of waste. We're going to keep kind of going through looking at creative ideas and just how do we get a little bit closer to the ideal. And so to bring this full circle is we're going to start from current to ideal. And we're going to ask about, what gaps exist. So this was our original one, this huge 1-day wait time that totally messed everything up. And then we're going to go from current to ideal, and then we're going to try out an improvement. So we'll do an improvement and we'll compare the improved state to the ideal. So, okay, we did one change. We got rid of that big 1-day wait time. We got this down to like 6 hours. So what do we do next? What were the successes? What were the remaining challenges? So then we're going to look for future to improve. So, okay, this time, this is the new challenge that we have to, there's some manual visit matching codes like, oh, I have to determine if what you need is a 30-minute visit, a 15-minute visit, right? So some of this manual process we still need to clean up. So how would we go about doing that? And we're going to do another improvement cycle. And then we're basically going to keep doing those improvement cycles until we get to close to our ideal state. And sometimes the ideal state will include some like redesign of the process as well. So, the quality is not just one and done. We're working through iterative cycles and we're redrawing our map with every cycle. Any questions on this? Are most folks familiar with the concept of iteration? And maybe if you're using a flowchart, have you done some redrawing of your flowcharts in past projects? Okay. See a few heads nodding. You can put it in the chat. So putting it all together, how do we use these value stream maps for improvement? So we're not jumping right to solutions. We're taking the time. We're looking at systems, processes, steps. We're really focusing in on these things, right? And so like creative and talented people, they make the best decisions about solutions when they understand the problem. They have the technical data, they have the experiential data, they're supported, they have the resources they need to do the job. Then we're going to map that process, and we're going to really understand first where we are today in that current state, and then where we want to be in the future, in an ideal state. And then we're going to work in between through improving and kind of comparing to where we want to be next. We're going to break it down into smaller chunks. Actually walking the process and talking to people doing the work and receiving the services is the best way to create a value stream. And last but not least, as creating a value stream map is going to provide some advantages for data-informed process improvement. So we're going to be tying it into the strategic project planning and reporting. We're going to align improvements with strategic initiatives and program plans. We're going to have sustainability, visual aids for training on process. We're going to be able to kind of communicate things because we can condense a big system like some value stream maps. Because we're able to put a lot in those process boxes and data boxes, we can distill down what would be overwhelming and complex swim lane maps or flowcharts into things that are a little bit easier to see. So improvement equals change, but not every change equals improvement. So changes should be informed by data, collected on clearly defined process, and reflect those changes that deliver value to customers and stakeholders. So we want to make sure that we're mapping everything out. We're looking at those data boxes. We're collecting data. We're looking for waste. We're seeking to improve that. We're redrawing our maps to make sure we're getting a little bit closer with each step of the way. All right. Again, do I have any questions? All right, I'm going to stop sharing and open it up for questions because we covered a lot of ground. Maybe there's some new symbols, maybe there's some new concepts in redrawing the maps, maybe there's some new measurements that you might not be familiar with. So I'll just open it up for questions. Has anyone tried a value stream map before? Good, I see a few folks. Conzita, I'll put you on the spot. What were any advantages or disadvantages that you had doing the value stream map versus maybe some other process maps you've done?
So I didn't want a value stream map. I think before that I did Gemba walk. So that helped me a lot. So, just follow the steps and write it down, and also then thinking through what is adding value and what is required and what is not adding value, and then to map out like the time also and percentage like that. Yeah, I think just we did one time, and now our programs are doing value stream map, some programs. Yeah, but we never tried improved value stream and future one. So that sounds new to me.
Great. Yeah, I think it helps narrow down because it is a more data driven and not just quantitative data. There's also qualitative data you can capture in these things. It helps narrow down those root causes, and the value stream map, because it's like so organized and there's so much measurement on it. It's like, okay, we can kind of see that there's a problem here, and that's where we want to start. We want to start upstream where that problem starts. So I think it makes root cause analysis. I feel a lot more confident in it when I have a value stream map.
Yeah, I find it helpful. It's different than Gemba in a way that we think through what is adding value and what we want to remove, process improvement or other waste. That gives more opportunity to brainstorm than Gemba walk. I'm kind of comparing because we did Gemba walk first and then value stream. They are linked together somehow. I don't know that they are helpful, but value stream gives more opportunity, more ideas.
Right. Yeah, it's just different stages. I think they're both really helpful. Do that Gemba walk first, get your observations from the Gemba walk onto your SIPOC, and then use your SIPOC to make your value stream. That's how I've found it most helpful. Because then you're not doing it all in like one big piece. And if you're using either plan and PDSA, or it's probably define and measure in DMAIC, it kind of spreads it out into 3 tools. And so it gives folks another chance to really understand that process instead of trying to create a map from with not a lot of information.
Yeah.
How about others? Any other questions? Is there anyone that's like, okay, this was interesting, but maybe I came here hoping to learn XYZ and you didn't maybe get it? And if anyone feels like, oh, this is a little overwhelming, again, be sure to check out part 1, because I think that kind of leads up to a more simple way of looking at flow. And then it might be worth revisiting this one, because this is a little bit advanced. A value stream map is not a good, not maybe the perfect tool for smaller processes, for beginners that have these kind of smaller projects. A value stream map could be overkill. But for more complex, like system level change, I actually think they're easier to do once you get the hang of them. There's definitely a learning curve. Well, thank you for the feedback, Lauren. Yeah, a lot of new tools. It never hurts to have enough too many tools in your tool belt, and then it just kind of becomes the process of knowing when to use which tool in which right scenario.
Just when I can ask one question, it looks like we have some time. So do you guys create multiple value stream map depending on project improvement? So like one is current state, then at multiple time frame. How do you do that, and when you do that?
Right, so current state is whatever baseline is. So there's obviously there's kind of some kind of fact finding and prioritization that goes on in the background that before you even walk the Gemba. But basically the current state map is drawn based on what was seen on the Gemba walk. So we're using the data, any times we collected, any things we saw, any opportunities for improvement, all that is coming from the Gemba walk to populate the current state, the first current state value stream. And then so you go from current state to ideal, like what could this realistically look like? And then you kind of just fill in between with, okay, from where we are today, from current state, in 1 to 3 months, what kind of ideas do we want to try that'll get us closer to ideal? And that becomes your first future state. And then you actually do the change and you map it again. And that's your first improved state. And then you do another future, and you just keep following that process with iteration. And I mean, these electronic tools are super helpful because, in some other projects, like it's good because when I just need to do 1 or 2 steps change, a few times change, and I'm just like copying over, duplicating the past map and just changing those times, pull out a step here, change this from push to pull. And it doesn't take a ton of time. It's getting that first one, those first 2 done, the first current and ideal, like that's the hump. But once you get over that, then it's just a matter of changing things, collecting data, which you're going to do anyway, and then just repopulating the map with a few small changes.
Okay, thank you.
Yeah. Great question.
Yeah.
Any other questions? Great, and thank you, Chris, for your comment. Glad these are informative. Yeah, so it's always, it's always good to broaden horizons and learn some. These are definitely more advanced tools. So I thank you all for joining. Kevin or Kamisha, anything else to add?
Not really. I found it was a great presentation. And one thing that I just want to kind of reinforce what you said, these tools, a lot of people associate them with lean. They're not necessarily lean tools, quote unquote. Think of it as Justin said, is, more things in your toolbox that you can use. There's no reason why you can't use a SIPOC diagram if you're doing the model for improvement or something else, okay? Same thing with control charts or any other thing like that. The more tools you have, the more information you're going to get, and the more successful you're going to be. That was my wisdom
great.
for the month. Yeah, that was about it.
Great reminder, Kevin. I mean, the SIPOC, I love like SIPOC, like that was a game, especially if you have like a lot of visual people that like need to see it and they don't understand how the pieces of the puzzle fit together. I find SIPOC is really helpful to kind of getting everything on like one sheet. Like this is, and then you kind of say when like I know we've all worked on projects where one person's like, oh, but what about this? Or did you think about that? And if it's not on the SIPOC, it's out of scope for the project. Like, thank you. We'll take that. We'll put that in a future improvement idea. But like really, it helps. Sometimes being limiting could be helpful to doing a improvement project effectively and quickly.
Yeah, you have to have focus to do an improvement project. Are there any other questions? Well, this is the moment that you've all been waiting for, the poll that we're about to put up. I know you're all excited about that. So Shmei, can you put up the poll, please?
It's launched.
Okay. Oh, that's right. I can't see the responses.
No, not yet. But we're
No,
at
that's fine. That's fine.
30%. You can see the percentage though, right? Like
No,
oh, okay,
no.
okay.
No, but that's why I was asking to make me and Justin a co-host.
Oh, oops.
No, don't worry about it. It's fine.
Multitasking.
I thought so.
I'm on a whole other call at the same time, actually,
Oh,
to be
good
honest.
Lord. So basically, the New York State Department of Health, besides their other forays into silliness, are basically trying to split Shmei or perhaps clone her so she can do 3 or 4 things at once. So far, the experiment hasn't worked, but we're hopeful.
I'm working on it. Somebody thought I got cloned because they saw me in one area of my
Yeah.
office for like a minute, and then I was at another. The next minute they
Yeah.
saw me and they're like, wait, you were just there, but you're here now. And it was
Yeah,
funny.
that happens. Roller skates work.
Yeah, exactly.
They're great.
Exactly.
Yeah.
So we're at 82%.
Oh, no kidding. Thanks, everybody.
Think that's pretty good right now. So
Yeah,
I'm just
it
going to
is.
end the poll.
Okay, that'd be great.
Do you want me to share the results or?
If you'd like.
No problem. There you go.
Okay, thanks. So, and the offer that I'll make to any and everyone is if you feel you need more help in these areas, or if you want to learn more, or if you feel that you'd like to have Justin or someone else actually come to your facility and sit there for weeks at a time. I'm just kidding. But fill out a TA request. They can be found on the Target Center at targethiv.org/CQII. And CQII, formerly NQC, has been supplying TA to Ryan White recipients for well over a decade. So if you really feel that you need some help or you just want to get going, you're not really involved in quality management or quality improvement, let us know and we'll be more than happy to help you.
Yeah, and I'll also plug the advanced and forthcoming intermediate learning labs. They're like 6-session modules that they kind of go through. Like a lot of the value stream map content came from the advanced learning lab.
Yeah.
Some of the process mapping content from last time will be in the intermediate. So those can be a helpful way to get smaller bites of new quality tools and project help as well.
Yeah, absolutely. And there's other learning opportunities on the Target Center website. There's TA calls that are obviously very focused like this was. There's a course that was given in October and November of 2020 called Choosing an Improvement Project. So it's kind of self-paced. So there's a lot of information on there. And not just from us either. I'm having trouble speaking. So basically, the more you know, obviously, the more effective you're going to be. But like I said, we're here to help. So please take advantage of that. So are there any more questions before we bid adieu? Okay.